Hello, everyone. My name is Charles Moser. I am the founder and managing partner for the Dental Science Alliance, and I am so lucky today to have with me Teresa Williams. Now, let me tell you a little bit about Teresa. She is a COO, CFO for a fairly large emerging group in San Diego, California, and her background includes working at a top-tier accounting firm. She's renowned on speaking on the subject of revenue cycle management. I've had the pleasure of sitting with her on several panels, and today I have Teresa here to answer for you a really important question that we see all the time on social media. And so the question is, Teresa, and all of your experiences and hirings, and even I'm sure you kind of came up through the ranks, right? What are the 3 to 4 really important qualities that an owner should be looking for when they're looking to hire an office manager, which you have said could be actually a production role?
Yes, I would 100% say your office manager has probably the most influence on your production. Whoever is leading the team with the schedules and is leading the team with treatment acceptance, they have a ton of influence. And so what I look for in a great office manager, leadership would be great. I would say it's not top of mind though. If you have a strong dentist leader, having an office manager that's a great partner that can be mentored can oftentimes produce great results. What we have to have are strong communication skills. So a lot of things I'm going to say make great leaders, but they're have tos and non-negotiables when it comes to an office manager. You've got to have strong communication skills, and they've got to have a lot of empathy. Office managers are getting it from all sides, from the patients, from the front office team, the dental assistants, the hygienist, the doctor, the vendor on the phone. So they've got to have a lot of empathy for what others are going through, and you translate that through those communication skills. They've got to be adaptable. Their list of responsibilities, it can be exhaustive and it should be exhaustive. So adaptability is key. Someone that wants to just kind of sit in their hole and do their job, they may be a great technician and technically good at their job or good at billing, but they might not be the person to take your practice where it needs to go. And you notice I didn't say that they needed vision and they needed strategy. Honestly, in a single doctor office, that's not the office manager's job. That's the doctor's office. In a multi-site DSO, that's going to be your director, your regional manager, or that's going to be someone that really can step outside of, when we talk about doctors stepping outside of the chair, stepping outside of the operator's chair, where they can see from 30,000 feet. So if you're expecting strategy and vision from an office manager, you're not being fair. They're in the fire, and we don't want that for them. We need someone, again, that's adaptable, empathetic, strong communication skills. And what you don't want to look for is a bargain. I see this happen as well. My sister has this friend and she used to run the tag agency, and I'm thinking she could run my business, and I'm going to get her for like 25,000 a year. You're going to get what you pay for. And they're not going to have that technical expertise to adequately lead your team and help them solve their problems. If you were to ask a team what makes a good office manager, they're going to say someone that understands what we do, that understands the practice management system, that knows the software, that can help me when I get stuck with a patient. And they're not going to have a lot of respect for someone you bring in from an outside industry that they feel like they had to teach how to do their job.
You said empathy. I'll kind of just put slash humility after that as well. You just have to understand that no one person can know everything.